So a typical candidate who would come in for a consultation regarding a breast reduction is going to be a woman who's been suffering from shoulder pain, back pain, neck pain. Often they'll have complaints of rashes between their breasts or even under their breasts, not fitting into their clothes well, being unproportional, feeling top heavy. These patients often have both physical and emotional symptoms that we're trying to address. So how our breast reduction surgery is performed is that we'll meet you in the preoperative area and do our surgical markings. The incisions are made typically around the areola. We basically leave the nipple and the areola attached to a pedicle of tissue, and then any extraneous tissue is removed and everything is closed back up. So your final scar ends up looking like a lollipop. So immediately after surgery, you'll wake up in our recovery room. You'll have a surgical binder in place with some dressings underneath. Most patients are pretty comfortable after surgery, but some complain of some burning sensation, which is very normal. We do inject long-acting numbing medicine at the time of surgery to help you manage your pain afterwards. But afterwards you will be sent home with some pain medication. You should expect to have 1 or 2 drains in place. You do need to have someone come with you for surgery. You'll need someone to bring you to the surgery center and then drive you home afterwards. And you should have someone with you, staying with you for 24 hours for monitoring. Post-operatively, we will typically see you within the first 3 to 5 days. We'll try to get those drains out. And then I'll see you at 1 week, and then typically at 2 weeks, and then we'll start stretching them out just depending on how you're healing up after surgery. 6 months to a year after surgery, most of my patients are feeling like their lives have changed. They literally have a weight taken off of their chest. They're fitting into clothes better. They're able to be more active because their breasts don't get in the way. They're out there kind of living their best lives afterwards. So if you've been thinking about a breast reduction, the next steps would be to call our office, schedule a consultation. We can help you navigate whether or not this is going to be covered by insurance or if this will be a cosmetic cost. And then after you've met with us, and then we can get the ball rolling and get you scheduled. The process is easy, quick, and overall discreet.